you talked about healthcare data being incredibly private. So how do you get that level of accessibility while keeping those sort of important personal details about people's health private?
So HIPAA, which is our healthcare privacy law in the United States, defines the process of de-identification. And de-identification has two paths under HIPAA. One is called safe harbor. With safe harbor, you strip out all of the PII, all the personal identity, all your social security number, your birth date, your name, address, all of that gets stripped out, but also all time and all location. Because time and location are two critical elements of re-identification. If you know that that a baby was born at a certain location at a certain time, you have a higher probability of re-identifying that person. So you have this one path where you strip out all time and location. The problem is that's really tough for any sort of public health analysis. That's really tough if you're trying to look at outcomes that occur or interventions that occur at one point in time and outcome. So the other path defined is that there's a statistical threshold of re-identification. Now this gets much more complicated, and it's really an AI problem to say, okay, we're obviously going to strip out all the PII, done. But then we're going to start redacting elements of uniqueness. We're going to reduce the granularity of time from down to the second, maybe down to the year, maybe down to the quarter, maybe down to the month. We're going to redact location from zip 5 to zip 4 to zip 3 to county or state. But then you also need to consider, if it's a rare disease situation, then it is there's fewer people similar to this. You need less granular. You may need to redact other details. You may need to take it, instead of saying, a specific pancreatic cancer, maybe you say just pancreatic cancer, maybe you say just cancer. And so you're going through a statistical thing. You're creating this, you want to provide data that has the right, that balances utility and anonymity, but gets to this right statistical level of anonymity. And so you got to take into consideration all kinds of factors. If you're doing a study which has no need for geography, just take out all the geography, and that you then can include more granularity in other places. If you need a study that's going to have down to the date granularity, I need to know if it's this absolute date of July 1, July 2, July 3. Well, then you need to have less granularity in location, or maybe some of the other quasi-identifiers in the data. And so we've designed the system that takes these medical records and the things which are strict identifiers, like your name, the quasi-identifiers, your gender, your marital status, things like this. And then you have things which are really not identifying about you. And statistically tries to, that crafts a data set that maximizes utility at the threshold of re-identification risk that HIPAA requires.
Okay, that's absolutely fascinating. And just the ways people can reconstruct who a person is just from individual bits of information, and then maybe matching with some other data. So I'm curious, does the amount of detail that you keep in data set, do you need to know what the use case is for that data before you craft this partially anonymized data set?
Well, we do restrict the use. The data is used for healthcare research. It's used to improve health outcomes. This is not we actually strictly forbid the data to be used for any sort of targeting advertising physicians or patients. So the use case is very clearly about improving health outcomes, and that's contractually something someone agrees to prior to getting any access to the data. But then we still absolutely, we have studies being done that link moms and their children. And it's very important for studying maternal health and for studying vaccinations and what happens. Now, if you want a linkage between moms and their children, then you're going to take a lot less other details in geography or time or diagnoses, because that's knowing this mother has 2 children instead of 1 children, again, that's a re-identification vector. And so knowing, is it a public health study where you need geographic granularity, knowing it's a maternal health study that needs moms and their children linked, knowing it's you're studying a specific procedure where you need down to the second granularity of what's happening in the operating room. These are things which, we've got this incredible de-identification team and risk analytics team focused on creating the highest utility data sets to meet the needs of the study to be done.